Alright, so everyone, in this lecture, we are going to learn about one of the extremely important topic because it is going to explain how different organs are able to maintain their own blood supply according to their needs. And it will also help us to understand why the blood vessels in different organs do not all behave in the similar way. It means that the lungs reaction towards the difference between the blood pressure or the blood flow in our body is different from the heart and the brain. I mean, the approach is different from organ to organ. In the similar way, the kidney has its own unique mechanism, right? So whenever we do have any sort of the situation that may lead up to the hypoxia, every organ does they have their own different way to deal out with that. So in this lecture, I will not just list the organs one by one. Instead, I will try to connect everything in a logical sequence so that you understand the underlying principle first. And then organ-wise differences will become easier to remember. So let us just begin with the basic definition of the autoregulation. So autoregulation is going to means the ability of an organ to maintain relatively the constant blood flow, right? The constant blood flow over a wide range of the perfusion pressure. So the constant blood flow over the wide range of the perfusion pressure. In the simpler words, you can remember that even if the blood pressure changes within a certain range, the organ can adjust the resistance of its blood vessels so that its blood flow does not change too much. And that is very important because organs need a stable supply of the oxygen, and they do also need a stable supply of the nutrients. So if every small fluctuation in the blood pressure caused a major fluctuation in the organ blood flow, then the organ would become very unstable, right? So the basic idea is that the blood flow is kept relatively constant because the organ itself adjusts the vascular resistance, all right? And this is why this is called the autoregulation, means the organ regulates its own blood flow, all right? So over here, you can just remember it out that blood flow to an organ, the blood flow, wanted to recapture the concept, depends upon the two important things. The one is the perfusion pressure, and another thing is the vascular resistance, right? The perfusion pressure and the vascular resistance. So if the perfusion pressure rises, the blood flow should also rises. If the perfusion pressure rises, the blood flow also rises, right? But in the autoregulation, the organ compensates by increasing the resistance through the vasoconstriction. And if the perfusion pressure falls, the organ may reduce that resistance through the vasodilation, all right? And then the logic becomes that if the pressure goes up, if the pressure in the vessel goes up, the vessels constrict, the vessel starts constricting, and the flow is prevented from rising too much, right? And if the pressure goes down, the vessels start dilating, right? And the flow is also again prevented from the falling too much, right? So this is the basic foundation. Now let's have one of the basic question that how do our organs do this, right? So we do have actually the two broader mechanisms, right? And the first one is the myogenic mechanism. First one is myogenic mechanism. Students who have already done the renal physiology would be familiar with the myogenic mechanism. And the second one, we do have the metabolic mechanism, right? The metabolic mechanism. So in the myogenic mechanism, when the vascular smooth muscle, they are stretched because the pressure rises, so it contracts. So increased pressure causes the vasoconstriction, and this helps prevent excessive blood flow. When the pressure falls, so there is less stretch, right? And the vessel relaxes more and allowing the vasodilation. So this is especially important in the organs like the kidney, as I've said. And then of course we do come up with the metabolic mechanism, right? That's the another one. The organs in the metabolic mechanism try adjusting the blood flow based on the local chemical factors, right? Which are produced by our tissues activity. So if a tissue is highly active, it produces what? It produces the metabolites. If the tissue is highly active, it produces the metabolites, right? And that causes the vasodilation. These metabolites, they causes the vasodilation, and these metabolites increase the blood flow so that the tissue gets more oxygen and the nutrients. So example of some of the local vasodilators or the vasodilator metabolites are included the carbon dioxide, right? CO2, the hydrogen ions, right? The adenosine, the lactate, the potassium, right? And also the nitric oxide in some of the organs is to be used also. So now let's just, with all this background, let's move organ by organ. At first we come up with the lungs. So if we just look up to the lungs, we can begin off with the lungs first. So over here, you can just look up that because lungs are the exception and therefore very important. Most of the organs of the body, actually, whenever we do have the hypoxia, this causes vasodilation, right? The logic is very simple that if the oxygen in our body is low, the blood flow should increase, right? So that the tissue can receive more oxygen. But the lungs, they do behave differently. In the lungs, we do have the alveolar hypoxia that causes the vasoconstriction, right? This is one of the unique feature, right? That the alveolar hypoxia that causes the vasoconstriction. And this is very important point. At first, this may sound strange, but actually this is very logical because the purpose of the pulmonary circulation is not just to supply the lung tissue. It is mainly to bring the blood to the alveoli so the gas exchange can occur, right? So now imagine an area of the lung where ventilation is poor. That means the alveolus has the low oxygen. If the blood continues flowing to that poorly ventilated alveolus, the gas exchange will be inefficient, right? So that blood will not get properly oxygenated. So instead, the pulmonary vessels constrict in response to the alveolar hypoxia. This diverts the blood away from the poorly ventilated alveoli and toward the better ventilated alveoli. So the logic is very, very clear that if you do have the poor ventilation, right, it leads to the low alveolar oxygen, right, which leads up to the pulmonary vasoconstriction, and the blood is actually redirected to the well ventilated areas, and definitely this improves the ventilation perfusion matching, and that is why the pulmonary vasculature is to be considered as a very unique feature, right? And do remember that in lungs, hypoxia causes the vasoconstriction, but in most of the other organs, the hypoxia is causing the vasodilation. This is one of the most important distinction in the physiology. Then we come up with the heart. Okay, over here you have to remember it out that the heart have a very high metabolic demand, as we have also discussed previously. So it is continuously working and extracting a large amount of the oxygen from the blood. So because of this, the coronary blood flow is regulated mainly by the local metabolic factors, right? So the important vasodilator factors in the heart are the nitric oxide, the carbon dioxide, and also the decreased oxygen. So when the myocardial activity increases, the local metabolites, they start building up and they causes the vasodilation of our coronary vessels and start increasing the blood flow. So over here you see that the harder the heart works, the more oxygen it needs, so the coronary blood flow must increase. So now since the heart already extracts a lot of the oxygen at the baseline, the main way it meets actually to increase demand is not by extracting more and more oxygen, but by doing a increasing the blood flow, right? And so the coronary autoregulation is strongly tied to the local metabolic demand, right? So we can just simply say that when the myocardium becomes more and more active, it produces the local vasodilator signals, right? When we do got these signals, they start relaxing our coronary arterioles, right? And they start increasing the coronary blood flow so that the oxygen delivery matches the myocardial work. So that is the core concept, right, about the heart that you can prepare up. So about the brain, we can look up that the brain is another organ where actually the stable blood flow is extremely important. Of course, the neurons are very sensitive to both ischemia, right, and also excess changes in the intracranial dynamics. So the cerebral blood flow must be carefully regulated. Do remember that. And in our brain, the autoregulation is controlled mainly by the local metabolites, right? And over here, we do have certain metabolites such as the carbon dioxide, as you can see, right? And this also may associated with the pH changes, right? And this is going to be one of the very highest yield concept, because do remember that when the carbon dioxide it rises, okay, the carbonic acid formation also gets the formation increases and the pH drops, right? So what will happen? The cerebral vessels, they dilate, okay, and when the carbon dioxide falls, the pH rises, okay, and the cerebral vessels they constrict. So in the brain, do remember it out that if you do have the high CO2, it leads to the vasodilation. If you do have the low CO2, it leads to the vasoconstriction. This is clinically very important because hyperventilation, it lowers the carbon dioxide, and lower carbon dioxide causes the cerebral vasoconstriction, which can reduce the cerebral blood flow. So that is why the cerebral circulation is so closely linked to the carbon dioxide, right? So the basic mechanism behind all this one that you can cover up is that your brain, it uses the local metabolic metabolites, right, such as the carbon dioxide, okay, and the pH to maintain appropriate cerebral blood flow. And this ensures that the active brain tissue continues receiving the adequate perfusion. Now we can come up towards the kidney, and let's come to the kidneys, extremely important for the autoregulations. And over here, rather than I explain you the myogenic and also the tubuloglomerular feedback, I am going to attach the link below, right, where I have already explained both of these mechanisms in much more detail, and everybody can just look up to that link that we have actually discussed during the renal physiology. We can just save up the time meanwhile looking up to this lecture. And then we do have the skeletal muscle. So the skeletal muscles, they behave differently, right? Because depending upon whether they are rest, whether they are having some of the exercise. So do remember that during the exercise, the skeletal muscle becomes metabolically very active, okay? And as a result, many local vasodilator metabolites starts accumulating, right, during the exercise. And what are those? The carbon dioxide, the hydrogen ions, also the adenosine, the lactates, the potassium, right? And one of the important mnemonic that you can remember it out, that is the chalk, right? Every carbon dioxide, right, the hydrogen ions, the adenosine, the lactate, and the potassium, and also the metabolites. All of these, they cause the vasodilation and greatly increase the blood flow so that the muscle can get active, right? So you see that if you're exercising, more metabolism is being over there, right? So the more chalk is being going to be there, this chalk, right? All of these metabolites, and the vasodilation occurs, and definitely the end result will be there will be the increased muscle blood flow, right? So this is how actually exercising muscle can rise, right? The blood flow towards the exercising muscle dramatically rise, right? But at the rest, do remember that the skeletal muscle blood vessels are influenced more by the sympathetic tone, okay, at the rest stage, and especially in the artery. So at the rest, the vascular resistance is relatively higher compared to the exercising state. So therefore, the contrast is that at the rest, the sympathetic tone is important, but during the exercise, the local metabolites, their production of these metabolites, right, and leading to the vasodilation, leads up to the activity of the muscles, right? And then at last we do come up with the skin, right? So do remember that the skin is somewhat different from some other organs, and we have discussed that because its blood flow is regulated mainly for the temperature control, okay, and not primarily for the metabolic demand. This is also one of the distinction when it comes to skin as compared to the other organs, right? So in the skin, the most important mechanism is sympathetic vasoconstriction. Sympathetic vasoconstriction. What does that mean? That when the body needs to conserve the heat, the sympathetic activity increases. The skin vessels, they constrict, and the blood flow to the skin decreases, okay? And this reduce the heat loss. This reduces the heat loss. And when the body needs to lose the heat, so the vasoconstrictor tone is reduced and the skin vessels dilate, right? And more warm blood reaches the skin surface, allowing the heat to dissipate, okay? So the major role of the skin in the blood flow regulation is actually for the thermoregulation, right? And that is why the skin circulation is best understood in terms of the temperature control rather than the classic metabolic autoregulation. So we can just simply rephrase it all that in the skin, the sympathetic vasoconstriction is the most important mechanism for the temperature control, right? Or for the regulation of the body's temperature. I hope so that this is clear to everybody, and welcome to ask any sort of questions.